A very good morning, dear students. Rather, it's good afternoon.
Yes, ma'am.
Yes, it is? Okay, good. So we will start with the class. Now, today we will be studying again, we are still with F10, the substance use disorder. We have seen in all those previous classes about the substance use disorder about alcohol. Right. So today we will be discussing the other main substance which usually people do use and do abuse, and where they what are their signs and how do we deal with them. Okay. So we will be dealing with amphetamine, caffeine, cannabis, and cocaine. Now, please note, if you will refer your textbook, if you will refer Neeraj Ahuja, you will find small other substance which they do abuse. I am discussing the one which usually people use and they abuse, either as inhalant, either as a powder form, right? Apart from the alcohol. Alcohol we have discussed in detail. Now we will be doing the amphetamine, caffeine, cannabis, and cocaine. And if there is any other which small ones which we will be discussing. Okay, now. So with this, let's start with amphetamine related disorders. Remember, substance use, substance dependence, substance withdrawal. The definition and what it is applies the same for all the substance. Okay, it applies the same. We have discussed extensively with alcohol because alcohol is one of the main which people do abuse, and everything about that substance we have used. Now, people do abuse tobacco. People do abuse. Nicotine in the form of tobacco. People do abuse eating pie, right? People do abuse eating gutka. People do abuse and use and abuse eating all those Raja, Kaini, Gutka, 5000. All those are the other substance which they use. Please do read up on them, and please do a little bit of self study on your own on those areas. The main ones which usually which we need to discuss, I will be doing it with you all. Now, so let's do the amphetamine. Amphetamine related disorders. Now, in amphetamine related disorders, what happened here is amphetamine or amphetamine like drugs are the mostly used illicit substance. Okay, now after cannabis, cannabis is also a drug which we will be discussing in the later classes, in the later slides. Second to cannabis, amphetamine are the one which people do use and then they do abuse. Okay. We have literature from the United States, Asia, Great Britain, Australia, other Western European countries. Now, you may think, why is it maybe we are not abusing here? But yes, people do abuse. Okay, it is just that from the literature which we have, they have given it this. Now, the history of the amphetamine. Now, amphetamine is first synthesized in 1887 by the German chemist L. Leonov. Yeah. In the early 1930s, it is used as a respiratory stimulant. See? It is used as a respiratory stimulant where it is discovered marketed as an inhaler for nasal congestion. Yeah. Now, please try to understand these amphetamine and amphetamine-like drugs are the mostly common drugs which people do abuse, and even people do get addicted to it. Okay, now so this is the history of it. Now let's go on. Medical professional recommended amphetamine as a cure for a range of ailments. Now, what are the common ailments which they do recommend amphetamines? Okay. You have learned about these. You have learned in your pharmacology. If you have any doubts which you're not able to connect, please refer back to your pharma class and then just review your knowledge on this again. Okay. Now, so medical professional they recommend or usually they give these amphetamine for ailments like alcohol and hangover. Okay, what is the alcohol hangover that we have seen extensively in the alcohol classes? Okay, narcolepsy, depression, weight reduction, hyperactivity in children. ADHD, you have learned about ADHD in children. The methylphenidate, Ritalin, they usually give these for these children. Okay, and vomiting associated with pregnancy. So, is this drug bad? No, if we give in recommended dose, it is used. See, like we've seen about alcohol. Is alcohol bad in itself? No, it is not bad. It is because the continuous use ends up to the patient being dependent on it. Then they begin to abuse it extensively. Then they go to a point of tolerance, intoxication, and even signs of withdrawal up to the point of withdrawal, which we have seen in alcohol. Right now, so these drugs which they give. Now, you may think if people who use them leads to disorder, why recommend? Because they have the good effect of it. But remember, we are discussing in this F10. Okay, F10 to F19 about the substance and substance use, because these are the drugs which, when people use, there is always a high chance that they will become addicted to it, right? And abuse, and then go all those stages up to withdrawal. Okay, now let's proceed. In World War II, which is 1939 to 1945, the military in the United States, Great Britain, Germany, and Japan used a lot of amphetamines to increase the alertness and to be able to endure better and to improve the mood of the soldiers or of the military personnel. Remember, your attention in concentration needs to be good, right? You need to be alert all the time. So what happened during World War II? From 1939, they have used a lot of this. Now, how does it come? What are the preparations of it? Now, the names which amphetamines comes in the form of chalk, of meat, okay, gas, fire, okay. Major amphetamines currently available in use in United States are in the form of dexedrine, in the form of methamphetamine, which is dexogen, and amphetamine-like compound, which is methylphenidate, Ritalin, which is a drug which they use in child psychiatry, especially. In child psychiatry. Okay. Now, common street names. The drugs go by the street name of ice, crystal meth, and speed. Now, over here, I did try to ask about this, but those people that I have worked with, they did not give me any common name here in our state. Okay, there must be a common name, but I failed to get it. Okay. Now, so what happened with this? Now, the typical amphetamines are used to increase performance and induce euphoric feeling. So, for example, students studying for examination, long distance truck drivers on trips, business people with important deadlines, they have to be awake, they have to be alert, they have to be focused, their mindset and their concentration has to be good, right? So they take these amphetamines, okay? And it is mostly used by athletes in competition. You have seen those dope tests which they use, right? After you must have seen in Olympics, you must have seen in Commonwealth Games, right, after they have won, and those who are doing weightlifting, and those who are all the many athletes games, afterwards they said this have been failed the dope test, which means they have taken some drugs. Now, why do they take this? Okay, the curiosity here is why do they take? Because everyone wants to, for better increase performance and to induce the euphoric feeling. Okay, now this the age of 18 to 25 years old followed by 12 to 17-year old. So the for okay, so the use. By the non-medical use of stimulants, okay, here. So let's see the epidemiology. National Household Survey on Drug Abuse conducted in 2001 found that 7.1% of persons 12 years of age and older reported lifetime non-medical use of stimulants. Medically, doctor do prescribe, we have seen in the previous slide. Right, now, so the age is 18 to 25, which is followed by, again, 12 to 17-year-olds. So they use either in the form of powder, in the form of crystal, ice or crystal. Now, so what does amphetamine do to the brain? The neurotransmitter dopamine and norepinephrine are released in the brain and their reuptake is inhibited. Okay, so when the nerve cells in the brain and spinal cord are activated by amphetamine, what does it do? It works on the mental focus. That means it improves the focus of the mind. Okay, it works on the ability to stay awake. It increases the ability of a person to concentrate. So now with this, you understand why this drug usually truck drivers, students, those who have busy, hectic schedule, they take this. What is the main thing? This is how it works. So mainly what it does, amphetamine is, it works on, let's check this, the mental focus. It increases the ability to stay awake and the ability to concentrate is improved. Now, the effect of amphetamines can last several hours, whereas the effect of cocaine generally lasts less than 1 hour. Okay, so the onset of effect from injecting methamphetamines occurs immediately. When this drug is snorted, you know what is snorting? You must have seen in videos or you must have seen in YouTube when they snort, they in a powder form, right? And they snort, right? The effect occur within 3 to 5 minutes. Now, when ingested orally, the effect occur within 15 to 20 minutes. Now, this describes and this explains what are the different types and why some drug users prefer snorting and some prefer ingestion, but those who want immediate effect, they will go for snorting. So the effect occurs 3 to 5 minutes. Now, so what is the diagnosis? DSM-4 diagnostic criteria for amphetamine intoxication. Recent use of amphetamine or a related substance, which is methylphenidate, clinically significant maladaptive behavior or psychological changes, example, euphoria or affective blunting, changes in sociability, hypervigilance, interpersonal sensitivity, anxiety, tension or anger, stereotype behaviors, impaired judgment or impaired social or occupational functioning that develop during or shortly after the use of amphetamine or a related substance. This is the DSM-4 criteria. Now, two or more of the following developing during or shortly after use of amphetamine or a related substance. That means a client who abuse, right, here, this is intoxication, okay? What are the signs that the person is intoxicated? Okay, now there will be two or more of this: tachycardia or bradycardia, pupillary dilation, elevated or lowered blood pressure. Now, let's continue. Oh, there will be perspiration or chills, nausea or vomiting, evidence of weight loss, psychomotor agitation or retardation, muscular weakness, respiratory depression, chest pain or cardiac arrhythmias, confusion, seizure, dyskinesia, dystonias, or coma. Okay, now the symptoms are not due to a general medical condition and are not better accounted for by any other mental disorder. Then you say that these are the signs that the person is using, and these one or two following the use of the amphetamine. Now, please, whenever we study about substance use, be it alcohol, be it amphetamine, be it cocaine or caffeine, you have to understand these stages. Let's try to recall what we have learned in the previous class. In the previous class, what happened? We have learned that initially a person started to use it. Okay, all of a sudden people will not go into abuse. Please mark these take home messages. Okay, take home messages means you have to remember this now and later on in your profession. No person will just go straight boom into withdrawal. Okay, now the use is eventually a person will start using it. Right, we have seen what is used. They used, they continue using it, but it did not, the person is not dependent on it. Now, when the person started becoming tolerant and the person started becoming dependent on it, then the person started using it frequently to meet the desired effect, then they go into abuse. Right, now, when do they become dependent? They become dependent when that tolerance level, now initially they take little, then they increase, the tolerance level increase. Now, what explains this? If you will recall in the alcohol class of substance use, because of the reward, because of the morphine like substance that they act on the reward pathway, then they start to become dependent. Okay, the tolerance level increase even if they take more, and if they don't get, then they start having withdrawal symptoms. Okay, now these then we have seen what is intoxication and what is withdrawal in the previous slide. Okay, in the previous classes. Now, so let's try to see what is the criteria for amphetamine withdrawal. These are for the intoxication, right? And these are for the criteria for amphetamine withdrawal. That means cessation of amphetamine use that has been heavy and prolonged. So what happened? Heavy and prolonged, that means client starts developing dysphoric mood or two or more of the following physiological changes developing within a few hours to several days. Okay, now fatigue, vivid or unpleasant dreams, insomnia or hypersomnia, increased appetite, psychomotor retardation or agitation. In most of the cases, if these people, they do develop that substance-induced psychosis. Okay, they do go and their mood gets altered, right? So all these are the signs. And again, these symptoms, please mark, these symptoms are purely not due to a general medical condition, or it is not the co-associated factor of any other mental disorder. Right, so we can say purely that these are the withdrawal symptoms of amphetamine withdrawal. Now, what are they? Let's just review again. Dysphoric mood, or two or more of the following physiological changes which develop within a few hours to several days. Now, what are they? Fatigue, vivid or unpleasant dreams. Most of the time when we do the history collection, they explain about trips. Okay, these vivid unpleasant dreams, they have that delirious state, they will come. Okay, and then the client that I work with, most of them, they say, we have bad trips. Initially, we had good trips, right? So Unpleasant dreams are there, insomnia or hypersomnia, increased appetite, psychomotor retardation or agitation. Now, so when we say that these are the signs of substance use or the withdrawal, we are sure that there is no other like these are not the psychopathology or the symptoms which is due to any other medical condition or of the other mental disorder. Now, what is amphetamine dependence and amphetamine abuse? Okay, amphetamine dependence can result in a rapid downward spiral of a person's abilities to cope with work and family related obligations and stresses. In the first slide, beginning, why does the person take amphetamine in the first place? The person take amphetamine in the first place because I think the person cannot cope with stress, right? Now, why everyone does not abuse? Why everyone does not use? Because the way they cope is different. Right, now you have to understand a stressor. Always remember when we talk of stress, be it a biological stress, psychological stress, or social stress, or a biopsychosocial stress that stem out from the interrelation, anything that produce anxiety, okay, to or that increase the anxiety of a person, that is a stressor. Okay, that's why stress and stresses we have, I told you, if we don't say, oh, we are stressed out. Every day to har din to stress nahi hota. Even use stress stage is there. Little bit of stress is needed, right? In order to push us, in order to motivate us, to drive us. But when the stressor increases the anxiety, then it is a factor which needs to be taken into consideration. Okay, now when is a person said to be dependent on amphetamine? Doctor gives them for few of the disease condition or few of the condition which we have seen. Now, a person becomes dependent when if I abuse or if I have been using amphetamine, if I don't take my, that means if I am a candidate who has developed dependence on it, that means my ability to cope goes down. I'm not able to cope with the everyday stresses of life. I am not able to meet any deadlines. I'm not able to study. I'm not able to perform. Right. So these are the signs that I am dependent on the amphetamine. Now, a person who abuses amphetamines requires increasingly high dose of amphetamine to obtain the usual high. And physical signs of amphetamine abuse almost always develop with continuous abuse. Right, now, I told you, you have to understand that a person abuse, right? Use, dependent, abuse, withdrawal, intoxication. Always keep this in mind. Always have this at the corner of your mind to whenever you relate when you study about the substance use related disorder. Be it alcohol, be it amphetamine, be it cocaine, be it cannabis, be it coffee, be it, and right. So always keep this in mind. These terms. Substance use, substance abuse, substance tolerance, substance dependence, substance intoxication, substance withdrawal. Always keep this in mind. If you are not very sure of it, please refer back to the previous classes and please note properly what are the basic description or the basic criteria that explains in these terms. Okay, now. So when a person shows that that means a person's tolerance level is high. More dependence, more. See, let's read here. A person who abuses amphetamine requires increasingly high dose of amphetamine to obtain the usual high. Initially, they take a small thing, they get that feel good thing. Okay, that reward is good. Remember, again, the conditioning reward pathway is the same, right? And physical signs of amphetamine abuse always develop with continuous abuse. All those signs which we have seen, they start to show only when a person have been abusing it continuously. Right, now we have seen the signs in the previous. Now, what are the features then? The clinical features are elation, euphoric, and friendliness. Remember, any substance, when a person is intoxicated or have used, remember, inhibition. Substance use always reduce the inhibition. When there is reduction in inhibition, a person becomes very friendly. A person, all those inhibition, you know that if ego, superego, no, I have to do this, no, then the superego will say this, then the ego will balance it out. Okay, so always, whenever a person has taken, there is always a saying, if you will see in movies or when you will read literature, a guy who's very quiet, okay, who cannot say one word, one peck you give to that to that guy, and then words flow like flowing water, and then it becomes a friendly hi, how are you, and they mix around. Then their personal relation. Why they become friendly? Because any use of substance always reduce or beat the inhibition which a person has. Okay, so features elation, euphoria, and friendliness. Remember those different terms when we have learned with mood. Yes, elation. Person becomes euphoric. Person have always that pleasant elationness, that always a high feeling, an increased feeling, right? Remember those terms, right? Now, so what are the adverse effects? Now let's see what are the adverse effects. In the physical effect of amphetamine, it affects the cardiovascular. It affects, the cardiovascular, the cerebrovascular, the GI system. So what are the effects there? In the cerebrovascular, myocardial infarct. You've learned about it, right? Then severe hypertension. Then CVA or cerebrovascular diseases and ischemic colitis, right? Then there will be neurological symptoms like twitching, to tetany, to seizure, to coma, and death. And non-life threatening adverse effects like flushing, pallor, cyanosis, fever, headache, tachycardia, palpitations, nausea, vomiting, bruxism. Okay, bruxism, that means teeth grinding, shortness of breath, tremor, ataxia. All these terms you are very familiar, so we will not go in detail with each term. If some students you are able not to connect with these terms, please refer back to your MathSearch classes, refer back to your MathSearch textbook, and then do read these terms. Now what are the psychological effects? Psychological effect, the adverse effect, okay, we are doing the adverse effect. There will be restlessness, there will be dysphoria, insomnia, irritability, hostility, and confusion. Now, amphetamine can also induce symptoms of anxiety disorders such as generalized anxiety disorder. This we will discuss. We have this comes in F40. Okay, we will be discussing when we will be reviewing again the classes, and panic disorder as well as ideas of reference, paranoid delusion, and hallucination. Now you will understand why those patients that come to Sun Care, the patients that we have interacted, we have seen some of them are in the high dependency unit because of psychotic symptoms that they have. And then when you collect history, then you come and tell me, oh man, they are abusing substance. It is because they have substance-induced psychosis. Okay, now, so what is the treatment for every psychotic symptoms? We all have discussed in detail, you know what are these psychotic symptoms. So antipsychotics is given to them. For the low mood and the depressed mood, okay, all those antidepressant is being treated. Now, along with these main treatment comes the other treatment modalities like Again, psychotherapy in the form of CBT and all those different behavior therapy that we give, which we have discussed in the previous classes. Right now. Now we are done with amphetamine. Now, take home message on amphetamine is what is amphetamine and what are these drugs all about. These amphetamine, just take home. If you don't remember anything, remember that amphetamines are drugs which they use to improve the alertness, okay, to increase the performance and to increase that feel good factor. Okay, so usually who takes? Usually students studying for exams. Why? Because it stresses more, right? They want to be more alert. They want to perform better, right? And then long distance truck drivers, because they need to stay awake for a long time. They have to be alert. And business people, because they abuse. Okay, then it is abuse of business people, drug, athletes, by soldiers. We have seen from history that it is usually given to people who are in the war right now. So what does it do to the brain? Usually amphetamines do. What is its effect? It improves the mental focus. It improves the ability to stay awake. That's why now you understand why students like to abuse amphetamine, because they have to be awake. They have to study so much to learn and so much to study. And then anxiety is more, okay? So they need to stay awake and they want to improve in the concentration also. Now, so how soon does a person get the effect? If they snort, they will get within 3 to 5 days. If they take orally, the effect within 15 to 20 minutes. And if they inject, the effect goes immediately. Right. Now again, effect lasts several hours. That means longer effect is with amphetamine rather than with cocaine. Right. Now, so what is it? So can the person be dependent and can the person have withdrawal symptoms of this? Yes. So these are the signs. Now remember, the signs of withdrawal or intoxication should not be there if it should not be related to any medical condition or it should not be related to any other mental disorder. So these are the take-home messages of amphetamine. Now, what does it do? Does it have adverse effect? Definitely it have. If a person abuse and a person is dependent, intoxicated, definitely it does. So these are the physical effect, the psychological effect too. Now, so we treat, and then for the psychotic symptoms that comes out, we give it antipsychotic. For the depressive symptoms or the low mood, we treat with the antidepressant. Now, let's see caffeine. Okay, before we go to caffeine, do you have any question with amphetamine? Dear students?
Yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
So you have understood what amphetamine is and why do people use and abuse it? Yes? Okay. Yes, I think it's a yes. So we will go to caffeine. I am a big fan of coffee myself too. Now, people also have. Now, let's try to understand why people use and abuse caffeine. Okay, now, what is caffeine in the first place? Caffeine is the most commonly used mood altering. If you're tired, let's go out for coffee. Right, we say that, right? Now, caffeine is found in numerous plants, the most widely consumed being coffee, tea, kola nut, cocoa pod, guarana, and mate. How you pronounce this? Some pronounce it as mate, some pronounce it as mate. Okay, those different types of coffee. When we go to a coffee bar and they give, okay, what kind of coffee do you have? You want cappuccino, you want latte, you want cocoa. Okay? All those have this caffeine. Okay, so it is estimated that in North America, between 80 to 90% of adults and children habitually consume caffeine. Okay, and some people they can consume coffee in that black coffee, right? Now all those coffee tea, they have this. Now, whenever we take tea, whenever we take coffee, we do feel that that relaxing thing. When we're tired, let's have a coffee. Then we feel fresh. Okay, why? Because it is caffeine is in it. Now let's continue. Now, so in the United States, average per capita daily intake adult caffeine consumed is 280 milligram. 30 milligrams or less of caffeine can alter self-reports of mood and affect behavior, and 100 milligram per day can lead to physical dependence and withdrawal symptoms upon abstinence. So caffeine is there in the 5-hour energy drink, the Coca-Cola that we drink, and the Red Bull with wings. It gives, remember, I have given this, we have discussed this example when we have studied the different terms, the disorder in mood, especially with ecstasy, when a client feels very elated and they have that rapture feeling, like that flying up, Red Bull with wings, right? And then Mountain Dew, all those, right? So they do have these. Now, coffee is a leading dietary source of caffeine. You will agree with me. In adults, even here, among adults in the United States, and even here in India, even here in Shillong also, in my place also, right here, we do take. Now, caffeine consumption from soft drinks. Please note this. Caffeine consumption from soft drinks has dramatically increased over the last few decades, and 70% of all soft drinks contain caffeine. Soft drinks are what? Your Coca-Cola, your, what is a soft drink? Coca-Cola, your, tell me? All those Mountain Dew and all that. Okay? So,
Red
now,
Bull.
huh? Come again? Soft drinks that the latest current one, I never take, so I don't know. Okay, let's see. What is caffeine all about? Caffeine is a white, bitter, crystalline alkaloid derived from coffee or tea. It belongs to a class of compounds called xanthines, its chemical formula being 1,3,7,5-methyl xanthine. Caffeine is classified together with cocaine and amphetamines as an anoleptic or central nervous system stimulant. You understand why when we drink coffee we feel nice, right? We feel active, we feel alert because it works as a CNS stimulant. Okay? Now, what is the pharmacological aspect of caffeine? When a person drinks a beverage containing caffeine, the caffeine is absorbed from the digestive tract without being broken down. It is rapidly distributed throughout the tissues of the body. And if a woman drinks caffeine in the, if a pregnant woman drinks caffeine in the drink, it will cross the placental barrier and enter the baby's bloodstream. That's why we always later on when you will learn OBG, maybe from next month you will be starting with OBG classes, okay, depending on the requirement from the OBG department. Later on, when you will learn extensively about pregnancy and antenatal mother, lactating mother, postnatal mother, okay, all that. Usually in pregnancy, we always say, don't take coffee. Okay, why? Because or don't take any drink that has caffeine because it crosses the placental barrier. Placenta is what? Placenta is the connection or the where it is connected, it has the maternal side where it is formed in the uterus, and it has the fetal side, okay, where a sac is formed, and then it is being connected from the baby and the mother with the umbilical cord. Okay, now over there you will later on when you will learn a placenta. So the maternal surface is attached to the uterus of the mother. The fetal surface has a sac where the fetus grow. The baby inside the mother's womb is called a fetus. Okay. Now, how do the baby grow? The baby is connected to the placenta through the umbilical cord. Okay. So what is the umbilical cord? All the nutrition, circulation, everything goes there. Nutrition also, circulation, same. So this caffeine crosses the placental barrier and enters the baby's bloodstream. Okay, so now when the caffeine reaches the brain, it increases the secretion of norepinephrine, or a neurotransmitter that is associated with the so-called fight or flight stress response. Okay, that is how we feel, okay, nice, right, when we drink coffee. The rise in norepinephrine level and the increased activity of the neurons or nerve cells, caffeine intoxication resemble the symptoms of a panic attack. Okay, so what does it do? It improves the fight-flight response, right? Now, so caffeine content of food items and OTC preparation, we all know what OTC is, over-the-counter preparations, okay? Now, in brewed coffee, okay, 1 ounce means 29.57 ml, and we take roughly 1 ounce is equal to 30 ml. Okay, always remember 1 ounce is equal to 30 ml. You have learned this when you had learned drug calculation in first year. Okay, fluid and drug calculation. Now, brewed coffee has the content. Okay, the content of in brewed coffee there's about 8 ounce, 135 to 150 milligram. Instant coffee, that instant machine coffee, 8 ounce of it in the instant coffee, 95 milligram. Powdered cappuccino beverage, 45 to 60 milligram. Now, tea brewed with leaves or tea bags, 50 milligram. Iced tea, 25 to 45 milligram. Snapple iced tea, 21 milligram. Mountain Dew, 38 mg. Dr. Pepper, 28 mg. Diet Cola, 31 mg. Okay, now root beer, 16 mg. Coffee ice cream, 8 ounce serving, 60 to 85 mg. Coffee yogurt, 8 ounce serving, 45 mg. Dark chocolate candy bar, 1.5 ounce is equal to 31 mg. That's why they say when we are tired, I'm very fond of dark chocolate myself. When I'm very tired, I need, I used to pop it, dark chocolate. Okay, now, so what is the relation between caffeine and health? Now, let's try to understand this relation. Caffeine and health. Caffeine use can be associated with several distinct psychiatric syndromes. Now, what are they? Caffeine intoxication, caffeine withdrawal, caffeine dependence, caffeine-induced sleep disorder, caffeine-induced anxiety disorder. Now, with regard to the cardiovascular health, do you think caffeine have any effect? It does. What does it do? It do increase the blood pressure. Now, studies suggested that if there is an association between high daily caffeine consumption and delayed conception and lower birth weight. Okay. Now, why daily caffeine consumption and delayed and lower birth weight? Remember, caffeine, even a pregnant mother drinks, it do cross the placental barrier and it goes to the baby's circulation. That's why babies born with LBW, lower birth weight, they call it. Okay, you will learn all this when you will be learning about midwifery, obs and gynae. Okay, midwifery and obstetrical nursing. Now, how does it alter the mood? Okay, now, why is caffeine a reinforcing agent? Now, you understand? Caffeine comes in the form of tea. Caffeine comes in the form of the coffee that we take. Caffeine, we can take in caffeine in the form of those soft drinks that we take. Brewed tea, iced tea, tea bags, all those. Now, what are the positive and negative effects? Now, let's try to understand. The positive effect is it helps us to stay awake, increase attention, alertness, and decrease fatigue. That's why when we're tired, we say, okay, let's have coffee. Right? Whereas the negative effect, it increases the anxiety. Why? We have seen that it excites, what does it do? It excites the norepinephrine level. So when there is a rise in norepinephrine level, anxiety increase. Right? Therefore, the negative effect is anxiety. Now, the other positive effect, it lowers the risk of cardiovascular but it does increase the vasoconstriction and blood pressure. It lowers the risk of diabetes, but reduce control of fine motor movement. The increased metabolic rate, the positive effect, and but it does there is stimulation of urination. So now let's just sum up the positive effect: increase attention and alertness, decrease fatigue, lower risk of cardiovascular disease, lower risk of diabetes, increased metabolic rate. In the negative effect, it causes anxiety, increased vasoconstriction and blood pressure, reduced control of fine motor movement, and stimulation of urination. Now, that's why they always say, those who drink too much coffee, they say it is not good. Right? Now, it is because of this. Now, so in caffeine, non-users or intermittent users, intermittent, you all know the meaning of intermittent. So low dietary doses of caffeine generally produce positive mood effects. If you take once in a while, or whenever you feel tired, or when you feel very lethargic, or when you feel you need to boost up your mood, okay, your feeling, your effect. So what does it do? Intermittently, it produces positive mood effect, increase in well-being, happiness, energetic arousal, alertness, and sociability. Large caffeine doses may produce negative mood effect, which means it may lead to increase in anxiety, nervousness, jitteriness, and upset stomach. That's why they say don't take coffee when your stomach is empty. Right? So this is if they take large caffeine doses. Now, why it is known as a reinforcing effect? Okay? Drug reinforcement refers to the ability of a drug to sustain regular self-administration. As the most widely consumed mood-altering drug in the world, it is clear that caffeine is a reinforcer. From all those classes that we have, those slides, previous slides that we have discussed, so it is clear that it is a positive reinforcer. Okay, now contemporary research shows that caffeine functions as a reinforcer when it is delivered in coffee, in soft drinks, tea, or capsule. For regular caffeine users, the avoidance of low-grade withdrawal symptoms such as drowsiness after overnight abstinence has been identified as a central mechanism underlying the reinforcement effects of caffeine. Right. So all these are explain why the caffeine is a reinforcing uh, drug or agent. Now, anxiety and caffeine. So negative effect of caffeine, it produces anxiety if the person takes on large dose. So studies shows high dietary doses of caffeine. Remember the it works on the neurotransmitters, norepinephrine. It increased, therefore it increased anxiety, and it induced panic attack in the general population. Individuals with panic and anxiety disorders are very sensitive to the effect of caffeine. Why? Because already norepinephrine is high in them, right? So that fight flight, anxiety stems from where? Any stresses, the minute already the fight flight is there, right? So those who are already with panic and anxiety disorders, even a little bit of caffeine also, they're very sensitive to the effect of caffeine. Now, sleep and caffeine. Studies have demonstrated that caffeine disrupts sleep. That's why they say never take coffee towards the late night, because you will not be able to fall asleep, right? And when you have to stay awake and study, when you have to be alert, when you have to have the good mood throughout the night, they say, okay, let's have coffee. Let's have black coffee. Okay? Most my friend who used to study with me, every day she will take a glass of black coffee. She's not a morning person, she's a late night person. Okay, very difficult for her to wake up in the morning, but she can stay the whole night. Now, she is one friend of mine who can really drink black coffee. Now, why? So, what is the relation between sleep and caffeine? Now, let's see. Studies demonstrated caffeine disrupts sleep. When caffeine is consumed immediately before bedtime or continuously throughout the day. So, what happened to the sleep? So onset is delayed, sleep time reduced, normal stages of sleep altered, and the quality of sleep decreased. Yesterday only everyone have explained about the circadian rhythm. You have learned about the circadian rhythm in first year. You have learned when you studied sleep. You have learned in second year also. In just yesterday also she had explained. Now, because of its ability to cause insomnia, sleep researchers have used caffeine as a challenge agent in order to study insomnia in healthy volunteers. Caffeine-induced sleep disturbances is greatest among individuals who are not regular caffeine users. Now, so what are the symptoms of caffeine intoxication? Okay, that means too much coffee is there. The symptoms are restlessness, nervousness, excitement, insomnia, flush face. Diuresis, which is increased urinary output, the GI disturbances. Why? Because too much of caffeine upset the stomach, right? Muscle twitching, talking or thinking in a rambling manner, tachycardia or disturbances of heart rhythm, periods of inexhaustibility, and psychomotor agitation. So these are the signs of symptoms of intoxication. Now, caffeine withdrawal. Caffeine withdrawal syndrome has been well characterized in a double-blind study. So you must have learned what a double-blind study by now because you have completed maximum of your research class. Okay. Now, the potential for caffeine withdrawal to cause distress or impairment in functioning is reflected by the inclusion of a caffeine withdrawal as an official diagnosis in ICD-10 DSM-4. That means a person can be addicted to caffeine. Why? Because if the person does not drink, the person gets withdrawal symptoms. Now, if the person does not get when the person gets withdrawal symptoms, so there will be distress and impairment in functioning. Therefore, the normal mental functioning, the normal everyday adaptation gets disturbed. That's why it is in the ICD-10. Okay. Although most research on withdrawal has been performed with adults, there is also evidence that children experience withdrawal effects during caffeine abstinence. Now, what are the symptoms of withdrawal effect? Headache, fatigue, difficulty in concentrating. Okay? Now, work difficulty, decreased motivation for tasks. I am tired. Chalo, let's go for coffee. Right. You all also do, right? Coming back from clinics, you will stop in the coffee corner and you will have tea. Why? Why do you feel good after that? It is because of all these effects. Okay? Then irritability, depression, anxiety, flu-like symptoms, nausea, vomiting, muscle aches, stiffness, hot and cold spells, heavy feelings in arms or legs, impairment in psychomotor, vigilance, and cognitive performance. These are the withdrawal symptoms of signs and symptoms of caffeine withdrawal. Now, so dosing parameters. Significant caffeine withdrawal has been shown to occur after abstinence from a dose as low as 100 milligram per day. Caffeine withdrawal also has been shown to occur after stopping regular once-a-day consumption of the caffeine, daily consumption of a single cup of coffee. Okay, these are the dosing parameters. Now, what is the severity of caffeine withdrawal? Okay, when signs or symptoms of caffeine withdrawal occur, the severity can vary from mild to extreme. Significant distress or impairment in daily functioning. This is the severity of caffeine withdrawal. Now, what is the time course of caffeine withdrawal? Onset usually occurs 12 to 24 hours after terminating the caffeine intake. Although onset as late as 36 hours has been documented, peak withdrawal intensity has generally been described as occurring 20 to 48 hours after abstinence. Remember, when do the person withdraw? Okay, that any substance withdrawal. You have to understand a person will get withdrawal when that level of that substance is not there. Okay, now why is the symptoms of withdrawal occurring? Be it alcohol, be it amphetamine, be it caffeine, be it any substance. Why? Because that as long as you maintain that level, right? We are dependent, right? So the tolerance level, when it comes down, immediately when it comes down, that withdrawal effect will not be there. Only when, see, some they occur immediately, some after 3 to 4 hours. When it comes to caffeine, it occurs 12 to 24 hours. So when that level comes down of that substance, then that body, you understand, because the body is conditioned to get it, the body is conditioned to get to have this, and then it affect the psychological performance, biopsychosocial relation again, right? So definitely when it is for a period of time, then withdrawal symptoms starts developing. Now, so that is about caffeine. Now, so caffeine is what? Caffeine is a content which is present in the coffee, which is present. Okay, let's just go briefly. Okay, caffeine is present in the in coffee, present in tea, present in your soft drinks, present in yogurt, present in dark chocolate. Right, now what does it do? Caffeine, it helps the why do people take caffeine? Because it increases the attention, it increases alertness, it decreases fatigue. Okay, when we try to take, and then but then if too much of caffeine we take, it does produce anxiety, and then it does affect the biological, the other biological areas too, like increased vascular construction, blood pressure, and all. Now, does it alter the mood? Yes, it does. Little bit positive effect. Too much negative effect. Why is it called a reinforcer agent? Because if you take, it does alter your mood, right? And does it work as a reinforcing? Does it has any effect on anxiety? Yes. If too much, panic attack. Right. If and then those who already have anxiety, a little bit of caffeine also, they respond. So that is anxiety. Does caffeine disturb your sleep? Yes, it does. Too much, it gets disturbed. What does it do? Some will not be able to sleep because onset delayed, sleep time reduced, stages of sleep gets altered, and quality of sleep decrease. Right now, so it may cause even insomnia too. So, what can a person be intoxicated to caffeine? Yes, restlessness, nervousness, excitement, all these, muscle twitching, and all. Now, can a person get withdrawal? Yes, they can. So, how do we know the person start developing headache, fatigue, difficulty in concentrating, and then irritable, all these? Now, what is the severity of the caffeine withdrawal? To the point that the person is under a lot of distress, and it leads to the impairment in the daily functioning too. Okay, now next we will study about cannabis. Cannabis, this is cannabis, okay? A picture of cannabis. I think it is available when you will go to community. Those I'm not sure, but you did not go to community much in second year, and but you will always see this cannabis here and there. Okay, now, so what is the profile of cannabis after alcohol? Cannabis is another substance which people do use and abuse after alcohol. Now, after cannabis, next, amphetamine are the one that they use and abuse. And which is the one which commonly use and abuse? Caffeine. Right now, so cannabis, what is the profile of cannabis? So cannabis is produced from Cannabis sativa plant. It is used in three forms: herbal cannabis, the dried leaves and flowering tops, also known as cannabis, ganja, weed, among others, or cannabis resin. The press reaction of the plant, known as hashish or charash or cannabis oil. Now, over here in my area, in our state, the cases that I have worked with, they have abused a lot. What they do, they abuse a lot of this cannabis after alcohol. Those who abuse alcohol, okay, one category. The other category of drug use, drug addict, most of them are really addicted to cannabis. They call it ganja here. They call it weed. It comes in a powder form here. Okay. Now, but then those who rear and those who grow this. Okay, it comes in the form of a leaf like this. Okay, and then they will powder it. Either they sniff the leaf. Okay, or they in that powder form they sniff or they inject. Okay, that is what the clients that I have worked with tell me. Okay, they may be telling, I assume that they will tell me the truth. Okay, now, a mixture resulting from distillation of extraction of active ingredients of the plant. Now, cannabis is produced in nearly every country worldwide. Oh, even here in my state also it is grown. Okay, highest levels of cannabis production comes in the Africa, particularly in Morocco, South Africa, Lesotho, Malawi, Nigeria, Ghana, Senegal, Gambia, Kenya, and Tanzania. Okay, and North and South American follow, each responsible for 23% of the worldwide production of cannabis herb. Okay, all those drug mafia and all those that comes from where? Because maximum is being produced in these areas. Okay, now Afghanistan has recently emerged as a major producer of cannabis. Right, now let's take the history a bit. The oldest known written record in cannabis use comes from a Chinese emperor Shen Nong in 2727 BC. In 1545, cannabis spread to the Western Hemisphere. So now let's try to see this, okay? Female cannabis and a male cannabis, okay? Now cannabis is a dioecious, meaning it comes as separate male and female plants. See, a male looks like this, a female looks like this. When you will go and you will observe, I have seen it is grown. The area that I go, which they produce here in my state, okay, where they have shown, it really looks like this. Now, usually male plants are taller and thinner and have flower-like pods which contain, see, these pods, now, all for the fertilizing pollen generating anthers here. Female plants are darker and shorter and has short hair producing at the end of the bracteal pod. So this is a female plant and this is a male plant. Okay, and people who grow this, they have told me, ma'am, this is the female and this is the male. Oh, I said, okay, I didn't even know that it come in this way. Okay, now, so marijuana paraphernalia. Most users smoke marijuana in hand-rolled cigarettes or joints. Other popular methods of smoking marijuana include using bowls, pipes, and bongs. Cannabis in the brain and body. Okay, now, what does cannabis do? The active ingredient in cannabis, delta-9 tetrahydrocannabinol, THC stimulates cannabinoid receptors located in the surface of neurons to produce psychoactive effects. The animal studies have indicated that THC exposure increases the release of noradrenaline. Norepinephrine, noradrenaline are always related to fight-flight response of the body. Okay, thus causing anxiety-like behavior in rodents. Always, these drugs, when they study in centers, right? They always study in rats and mice and rodents. Okay. Now, even most of the function of the brain also, if you will see literature, you will see that, okay, what does sleep have with the consolidation of memory? That also, they have done a study with mice, those white mice, okay? And then they observe their behavior and they come to a conclusion. Yes, there is a critic. They have criticized because human beings have emotions and responds differently than animals. But in most of it is that's why you have that standard deviation of difference, the index, the efficacy index plus two. Plus minus 2, right? Now, so a few minutes after smoking cannabis, heart rate increases and in some cases it doubles. Very interesting. Okay, let's try to understand. Bronchial passage relax and it become enlarged and the eyes become red as blood vessels expand. I have sat with them and I have seen. Working with these people who abuse this now, students is nice. I learned a lot firsthand. I do maintain their confidentiality, but I have always told them, see, when I will teach my students, I will always share your the case with my students, which my cases that I work, they have agreed. Okay, so as those effects subside, some users report feeling sleepy or depressed and others feel anxious or panic. Initially, when they take now, they say they feel high, good trips. Okay, every time when they start taking, they always have good trip. They will hardly have bad trips. They call it trips. Okay, that is their term. The addicts and the person who abuse, they have explained to me that they have trips. That's why from the use they go into abuse, dependent tolerance, then they go all those intoxication and withdrawal. Okay, now so after those good trips, now later on they say that they started having bad trips. Okay, when do they start having bad trips? Because they started reporting like they feel sleepy, depressed, they feel anxious, they feel panic, and then they have paranoid thoughts, they have acute psychosis, they have those tactile hallucinations, they feel something is scrolling. Okay, all that is what is being verbalized by them. Now, it has negative effect on memory, including the ability to form new memories and attention and learning. That's why you will see people who are substance-induced psychotic and those who have abused a lot of drug and especially with multi-drugged substance abuser. Okay, they abuse alcohol also, they abuse cannabis also, they abuse 101. You will feel no, they have very poor attention span. How do we know? When we do the mental status examination. Okay, now and they do require and to change them also. No, they need a lot of psychotherapy, CBT. Some with CBT, some of the behavior only with behavior therapy. Okay, some we have to retrain them with social skill training, some with communication. All those part of the psychotherapy. Now, these effects can last up to 28 days after the abstinence from the drug. Okay, now that's why you will understand why people keep using it again and again and again because the abstinence effect now it's not pleasant one. Now, so what does cannabis? What is the effect of cannabis respiratory and cardiovascular system? There is a burning and stinging of the mouth and throat, along with a heavy cough, daily cough production, frequent acute chest illness, and an increased risk of lung infections and pneumonia. Okay, now, and most of the time, most of the cases that I have worked with, we didn't. Initially it is not known that that they abuse. Only when we take the constant, when that trust and that bondness has developed and we constantly when we when we run the psychiatric history, when we run the mental status examination, and when and I like for me my in my the process regarding maintaining the nurse patient therapeutic nurse patient relationship, then only little bit slowly we will find, because usually they come only with these symptoms, right? And most of the times parents think that they have some medical condition, whereas it is indirectly or directly, it is because of the substance that they have abused. Now, so long-term studies from the USA and New Zealand shown that regular cannabis smokers, remember cannabis, they powder it, okay, either they sniff or they roll it in that paper. Okay, they were very interesting. They have lovely style of using. Okay, so the regular cannabis smokers report more symptoms of chronic bronchitis than the non-smokers. Okay, now so cannabis produce adverse effect on the cardiovascular system because cannabis and THC cause a dose-dependent increase in heart rate. Concern exists about adults with cardiovascular disease. Cannabis use can cause an increase in the risk of MI and provokes angina in patients with heart disease. Now, what is the effect of cannabis or pregnancy, or what is its relation? In women, cannabis smoking during pregnancy leads to decreased birth weight, most likely due to the effect of carbon monoxide on the developing fetus. Now you understand, because it crosses the placental barrier, okay, and whatever the mother takes, their circulation, the maternal fetal circulation, they call it, right? You will learn, very very interesting. You will be learning in the obs and gynae classes, okay. Additionally, infants exposed to cannabis in utero, that means inside, okay, show developmental delays in the visual system, as well as tremors shortly after birth. Okay, in utero, that means fetus when they grow, right? But they are exposed. How do they get exposed? Because of the substance they cross, okay, the placental barrier, and then what happens? So whatever the mother takes, it goes to the baby, and it does have effect. Now, all the children have some defects in higher cognitive process, such as perceptual organization and planning. Now, what is the effect with the cognition then? I told you from the previous slides, we have seen that it does have effect with memory. So what does it do? Okay, now let's see. Cannabis-dependent teens show short-term memory deficits as well as delayed record of visual and verbal information. Teens who continue to use cannabis heavily show poorer complex attention functioning as well as lower psychomotor speed and poorer sequencing ability. That's why you will see now kids those who use and abuse drugs at an early age. Most of them they start using. The clients that I work with, I have a client who started using right from class 5. Okay, that is the youngest client that I have been handling, class 5. Class 5, which means he must be at the age of 10, 11, from that. And he has abused multiple substances to the point that he dropped out from school, and then because all those things, and then now, and that time he is under therapy. Okay, so what happened? What does it do? So it causes with it does disturb the cognition. So it shows complex. That means attention span is poor, psychomotor speed slows down, and sequencing ability. What is sequencing ability? That means this. You perceive and then you arrange. Okay, first you do this and this, you become more organized. So they become a lot, there is a lot of disorganized behavior in them. Okay, now, so cannabis and mental health, mental illness. Okay, now what does it do? Now let's see. Cannabis use is associated with psychotic symptoms, schizophrenia, anxiety, and depression. Now, when compared with those who have never used cannabis, young adults who begin using the drug at the age of 15 or younger. I told you, my youngest client, right from class 5, 6, that means at the age of 9, 10, he has started. Okay. They develop psychotic disorder, and 4 times they are likely to experience delusional symptoms. Okay, now again, so CBR activation in the amygdala can produce anxiety, increase reactivity to stressful events. Where is this amygdala? This amygdala is in the limbic system. Okay, now, so So these neurological defects may also be responsible for reduced motivation, poor capacity to cope with stress. Now, so what are the reasons then for cannabis use? So if it has so much adverse effect, तो क्यों use किया? It is so addictive, this cannabis, I'm telling you. The clients I'm working with, I used to say, why? They said, पता नहीं था that we will be up to this. So what are the reasons? Let's try to see. Okay. Reasons were the most commonly reported reasons are just a child, a good time, to experiment, to get high. You know that good trips. I told you because they've seen others. Initially, they will always have good trips. Always. They will never have a bad trip in the initial use. That is why when they see others, okay, so that peer pressure. Peer pressure is one. When we have seen the psychodynamic of substance use, that applies to all, okay? Those etiological factors. It applies to all the substance now. So when they see this look good, so they also want to try. So that's how they use. Now, young adults men are more likely to use cannabis to increase or decrease the effects of other drugs, to seek deeper insight, to have a good time, and they become addicted. Reasons for cannabis use for both men and women include to be part of the group. Okay? Some, they have poor coping strategies. So to cope up with the stress of life, to conform to social norms. Because अगर नहीं लेना है तो you are not part of the group. You are a chicken. Okay, one of the client that I am dealing, he was telling me, you know what, ma'am, all my friends, but I didn't want to take initially. They said they call him a chicken, they call him gay, they call him 101 things. So because he wants to be part of the group, you understand, he wants to be included. That's how he started using the cannabis. Okay, now for mind expansion and to alter perceptions. These are most of the reasons which they have given when we have collected the history, what made them to use cannabis. Now, so what is the best practices in cannabis prevention and treatment? So I have told you, the younger we catch them, okay, catch them young, they call it. The younger we catch them, the younger, okay, you understand, the better we can give them the psychotherapy and the psych treatment. If they have psychotic symptoms, we treat them with antipsychosis, okay, antipsychotic drug. If they have other mood symptoms, we treat them with the mood stabilizer or antidepressant. If they have anxiety symptoms, we treat with those. Okay, now, practices in cannabis prevention and treatment. Now, so what are the risks and protective factors? Now, let's go through this. Both risks and protective factors affect youth at different life stages, from pregnancy through young adulthood, as well as in various domains, including individual, peer, family, school, and community. So when we think of substance use, we need to educate, okay? So any stages of life. Now, why do I say any stages? Initially, I always thought that, okay, we will teach when they grow up. But then the more I work with people with substance use, I realize that it is not only the person that require education and awareness, even the family, even the community, even those major stakeholders of the community, they do require this one, the awareness and the knowledge. Okay, so we should always the risk and protective factors, because anyone is at risk. Why? Because everyone fights and reacts in the biopsychosocial realm every day. Okay, now, so when not properly identified and dealt with early or negative behavior, remember those who have stresses. What are the stresses that cause the person to drink? Okay, or to use or to abuse. So if it can be identified at the early use, at early life, and we can deal with it, then if it is not identified and dealt with early negative behavior, then what happened? it makes a child more risky and susceptible for drug use and other problems. Now, effective preventative interventions reduce risk and increase protection at each developmental stage as well as within each domain. Now, media messages. We all know media plays a major role. So, social networking site, inexpensive mobile technology, and the increase of internet reach and speed have meant that young people are routinely exposed to various kinds of messaging and advertising. The young people and perception of risk. Okay, now, so what are the prevention of cannabis use? Efforts are critical because cannabis is often the first illegal drug used by youth. Everyone, because of the trips, easily availability, and it is not costly also. At 10 rupees, they will get one small cube. Okay, and when they smoke and sniff and use that, they feel high. And then they will, once they become addicted, then they start doing all the selling their clothes, do all that so get in order to maintain that drug level. Now, preventing substance use before it begins not only makes common sense, but it is also cost effective. In addition, there's also a need to focus specifically on community risks. Like, for example, areas when we have seen the psychodynamic factors that leads or that produce or that cause substance use, so we target those, right? So we target those, we give what to say, more awareness. Okay, so protective factors related to initiation and use of drugs, illegal drugs which include, okay, then we include the social norms, access, availability, and perceptions of the harm. Now let's continue. Now, what are the treatment? Since it is established that 1 in 10 cannabis use will become dependent, as one-time intervention for short consultation and literature, brief interventions such as the 12 sessions of substance use intervention, and then referral to treatment for dependent users, then specialized counseling, specialized care, case management, follow-up support in the community. Then a lot of them need and require CBT, okay, so that it increase self-control. And again, motivation enhancement therapy. Again, specific techniques include exploring the positive and negative consequences of ongoing use, self-monitoring to recognize drug craving, okay, self-monitoring, and then developing more strategies. That means behavior therapy, coping strategies, right, for coping and avoiding high risk situation. Remember, harm reduction, risk relapse prevention, okay, all those specific technique is being given to them. In several studies, most people receiving CBT maintain the gains they made throughout the year. Now, MET works best. We have seen what MET is, where the therapists provide feedback with the initial assessment, then discussion, and then all the self-motivational statement. And then they work with the coping strategies. Okay, MET is continuous motivation. Remember that model. Anytime they can exit, so they need a generous dose of empathy, a generous dose of understanding, generous dose of awareness, of harm reduction, relapse prevention. Okay, and then we don't need a lot of CBT so that their cognition change. Okay. So this is it. Now, last one is cocaine. Okay, cocaine. This is a high-priced way of getting high. It is called. It has powerful negative effects on the heart, the brain, and many cocaine users fall prey to addiction with long-term and life-threatening consequences. Okay. Now, what are the signs of cocaine use? Okay. Now, they can use abuse powdered cocaine. Okay. Now, so they seem excited and more confident and exhibit a greater sense of well-being. Those who use. Okay. What are the signs? And I told you, inhibition is less, so sexually very, very excited, libido is increased, and they become more talkative. Okay, and their energy pump up, and they will never have any appetite for food. Okay, these and will not have a normal sleep pattern. Now, traces of white powder. How do we know this? They usually sniff. Okay, they sniff. So you will know that they will always have traces of white powder around the person's nose. Okay. Now, while many people snort the drug, some will dissolve and inject it. A few will ingest it. Okay, but mostly from what I have seen, they snort. Okay. Now, then they have dilated pupils, runny noses, and after long use, nosebleed and damage to the inside of the nose. Cocaine user usually dissolve and inject the kit, which cause and we will find needle marks on their arms, legs, hands, feet, neck, and when we observe around, we will find discarded syringes. Okay, now powdered cocaine effects last for half an hour or less. So the user may leave periodically or she can use more of the drug. These are the signs. Now, so what are the signs? I told you because of snorting, there will be running nose, again nosebleed, and then we will have those injecting marks and burnt lips or fingers, okay, when we check their appearance. In their hearts, it causes heart rate to be fast, constrict blood vessels, enlarge heart attack, and it may even lead to cardiac arrest. Now, what does it do to the mental state? Yeah, now the person becomes euphoric, overconfidence, unusual excitement, person is very aggressive, paranoia, poor judgment, delusions and hallucinations, which again, psychotic symptoms. Now, after a long use of cocaine or when they binge, it causes depression, agitation, intense craving, and need for higher dose. That means dependence is there. Now, what are the signs of cocaine withdrawal? Cocaine withdrawal occurs when a heavy cocaine user cuts down or quits taking the drug. Complete abstinence and a serum drug level of 0 are not required. Now, causes. Cocaine produces a sense of extreme joy. One gives you happiness, another one gives you, cannabis because you feel nice, you feel good. Cocaine produces joy. Okay, how does it come? Okay, because it causes the brain to release higher than normal amount of biochemical. Now, cocaine's effect body can be very serious or even deadly. So, if cocaine is stopped when a binge ends, a crash follows almost immediately. So, what is the crash? Okay, now because they will have to maintain and they have strong craving. So the symptoms include fatigue, lack of pleasure, anxiety, irritability, sleepiness, sometimes agitation, extreme suspicion or paranoia. Very delusional, a lot of all those delusions they have. Okay. Cocaine withdrawal often has no visible physical symptoms like vomiting and shaking that accompanies the withdrawal from heroin or alcohol. So, cocaine is addictive when addiction is defined as a desire for more of the drug despite the negative consequences. Then the level of craving, irritability, delayed depression, and other symptoms produced by cocaine withdrawal rivals or exceed that felt with other withdrawal symptoms. Now, what are the primary symptoms? Cocaine withdrawal. Okay, agitation, depressed mood, fatigue, generalized malaise, increased appetite, vivid or unpleasant dreams, and slowing of activity. Now, the craving and depression can last for months, and they can even go into suicidal ideation. It can produce fear and extreme suspicion rather than joy. Okay, just the same, the cravings may become powerful. Now, the exams and tests that we do. Physical examination, history of cocaine use are sufficient to diagnose this condition. Blood chemistry and liver function test is used. Cardiac enzymes are checked. CBC, chest x-ray, urine analysis. Now, the treatment for withdrawal. The withdrawal from cocaine may be used as unstable as withdrawal from alcohol. There is a risk of suicide or overdose. People who have cocaine withdrawal will often use alcohol, sedative, hypnotics, anti-anxiety, diazepam, lorazepam, all those anxiolytics, okay, to treat their symptoms. Use of drugs is not recommended because it simply shifts addiction from one substance to another. So, at least half of the people addicted to cocaine will have mental disorder. Mostly, they go into depression and they have poor attention deficit and they come with a lot of psychotic symptoms. Okay, now these conditions should be suspected and treated. When diagnosed and treated, relapse rate reduces. Okay, now what is the treatment for cocaine abuse? Several medication marketed for other disease show promise and have reported to reduce cocaine use in controlled clinical trial. Disulfiram has produced the most consistent reduction in cocaine abuse. The same disulfiram that they use for alcohol, it has shown that it does work with the cocaine too. Okay, now, then what are the behavioral interventions? Same. We give them CBT, we give them behavioral therapies are often the only available and effective treatment for many drug problems, including stimulant addiction. So, that means the more when we club MET with the behavior therapy, the patient they recover better. Now, CBT focus on helping cocaine addictive individual abstain and remain abstinent from cocaine and other substance. Now, what is the assumption with this? It assumes that learning processes play an important role in the development and continuation of cocaine abuse and addiction. See, remember those core beliefs? So what do? We tackle with the core belief. We change their cognition. We help them to change their thinking, their perception. Automatically their behavior, the problematic behavior will automatically change. Okay, now, and then they are kept in therapeutic communities like Sun Care or residential program, which is also another alternative to person in need of cocaine addiction. Now, therapeutic community requires 6 or 12 months stay and use of program inside community as active components of treatment. They can include on-site vocational rehabilitation and other supportive services and focuses on successful reintegration of individual into the society. Okay. Alcohol, we club with AA. These also, they do come for the vocational rehabilitation. Okay. Now, community-based recovery groups such as Cocaine Anonymous. Remember AA? Alcohol Anonymous? They do have the Cocaine Anonymous too. And they use this 12-step program which help them to abstain from from using the cocaine. Now, so how do we take care of them? Same nursing diagnosis. Any substance, dear students, there is always, if they have psychotic symptoms, we have to deal with their psychotic symptoms. If they have thought disorder, deal with the thought disorder. If they have perception impairment, deal with them. Remember, they have a lot of risk for injury. We have to take care of their safety. Okay, then we have a lot of ineffective health maintenance. So, because their overall health condition gets disturbed, so we have to take care of that. Now, remember, there will be a lot of denial. Okay, a lot of denial will be there. No, because I used this, then I used this, then no, justification, rationalization and all, so much. That's why for them, CBT works best because they get better insight, they understand themselves better and they get to deal with their core belief, their cognition, and they get to deal with their maladaptive behavior too. Now, we will find that they have a lot of ineffective coping, poor coping strategies. So what do we do as nurses? We find out what are the positive coping, okay, and what are the negative coping. We find out what are their stresses. Again, from where? From the biological realm, psychological realm, and the social realm. Then once we work with them, either we work on their behavior, either we work on the cognition, or either we work on their stress management and we work on their daily life skill management, okay, or we work on their social everyday skill. Right. So, because their coping is poor, so we give them better coping strategies, irrespective of any of the substance. So, these are the main. Apart from that, the other holistic need that the patient have. Individual, they need a lot of psychoeducation. We have to give them. They need a lot of social skill training that we have to give them, and then they need a lot of family support. So, poor family coping always. So that's why these people come for family therapy. Remember, in Sankya, every Saturday is family session, right? They do keep coming for family therapy because family support and the outside support for these is very important, okay? Because it does affect the family life too. So keep these in mind and keep all the other need of the client whenever you take care of the client. Okay, so with this, I wrap up the substance use and substance use related disorders. I hope you have understood. Please do refer Neeraj Ahuja, and you can refer other nursing textbook. For the nursing care, you can refer Shivani, you can refer Mary C. Townsend, you can refer Gail Stewart. Okay, you can refer Psychiatric Nursing Care Plan. Now, to understand about the substance, the disease and the theory part, you can refer Neeraj Ahuja, you can refer this textbook which I have already told you. So with this, I wrap up substance use and substance use disorder. In the next class, we will be reviewing F20. After F20, then we will go F30. Thank you so much for your kind attention. I am sure you have understood. Do you have the concept? Please do read. And if you have any doubt in the next class, you can text me or we can discuss. Thank you, students.